Welcome to this British Psychological Society audio interview. I'm Wendy Barnaby and I'm joined by David Clarke, who is Professor of Experimental Psychology at Oxford University and who has just won a Lifetime Achievement Award. Congratulations, David, from the Society. We're going to be talking about cognitive behavioural therapy and the instrumental role you have played in having it introduced widely in the UK under the Increased Access to Psychological Therapies programme. But before we get on to that, just tell me about cognitive behavioural therapy, CBT, and why it is such a useful therapy.
Well, cognitive behavioural therapy is one of several psychological treatments that try and help people get over mental health problems such as anxiety and depression or eating problems. These are very common. About 1 in 6 people in the community will suffer from anxiety or depression. But the good news is that really over the last 20-25 years there's been really big steps forward in terms of developing effective psychological treatments where 50 to 60% of people with these problems can completely recover with a short course of therapy. By short I mean 2 to 3 months, and many other people get marked benefits. Cognitive behavioural therapy, which is one of the most common, is called that because it focuses on your cognitions or your beliefs and also on your behaviour. So we often get anxious because we mistakenly believe that something is much more dangerous than it really is. And we continue to be anxious because the way we behave prevents us from discovering that it's not very dangerous. So, for example, one of the problems I dealt with is called panic disorder, where people have sudden attacks of anxiety, where they experience lots of sensations, feeling short of breath, racing heart, tight chest, things like that. And they often have quite dramatic thinking. They think they're dying or they're losing control. The problem is that they aren't doing that. These are just sort of normal sensations. But once you think that you're dying, you get very anxious. And of course, when you get very anxious, that makes your heart race faster, you sweat more, you feel more dizzy, and so the whole thing spirals up into a really bad attack. And what people then do is they try and avoid the situations that would provoke them. They do anything they can to try and control the sensations, and as a consequence they don't discover that if they just stayed with them, they wouldn't have died and nothing bad would happen.
I was really interested to read about people. You talked about having a panic attack in a supermarket and the way they clung on to the trolley to try and help themselves, as they thought, remain upright instead of falling down dead on the floor. And in fact, this hanging onto the trolley, which they felt was helping them, was actually not helping at all.
That's exactly right. What you discover in therapy is if you sort of let go of control, then the anxiety itself goes away as well.
So if someone having a panic attack in a supermarket, what would you advise them to do?
Well, if you're in therapy, then we would take that as a rather magic opportunity to discover whether these things are as dangerous as you are. So the example that you gave of someone gripping firmly onto the supermarket trolley because they felt dizzy, in therapy we'd encourage them actually to let go of the trolley and walk into the middle of the aisle, maybe stand on one foot and discover they don't collapse. Of course, you need a therapist there often to help you take that rather frightening step, but it's often a wonderful step because you really discover that nothing bad is going to happen.
And so it's the influence of your beliefs on your behaviour that is the crux of this.
That's right, and that's why the therapy really focuses on your beliefs and your behaviour and changing both.
Now, you became convinced that as a country we needed far more access to this sort of therapy than we had. Can you tell me about that?
Yes, we had a real paradox. Big advances being made in developing effective treatments, and then almost no one in the country getting them, which was really crazy. And I was very lucky that I got together with an economist, Richard Layard, and we put together to the government a sort of argument that if they did train more therapists and employ more so they could deliver these treatments to a large number of people, that would not only be really good for the people who get the treatments, but it wouldn't cost the nation anything. And that is because untreated anxiety and depression is very costly, not just to the individuals themselves, but to the nation. So, of course, people are less likely to be in employment. If they are in work, they're less productive. So you get a reduction in productivity, you get a reduction in tax revenues, and also people who are anxious and depressed find it much more difficult to manage any physical health problem. So that costs a lot more to do as well. And so we put all of that together and really pointed out to the Treasury that, if anything, they would save money by making these treatments available. And thankfully, that argument was in principle accepted back in 2005. And since then, firstly the Labour Party and now the Coalition have been working hard to make these treatments more available. We had a scandal in England that before IAPT, the vast majority of people who were being treated for mental health conditions, no one recorded whether they got better or not. Sitting here now, it seems absolutely extraordinary. And now we get outcome data on 97% of all the people who are treated. This has never happened anywhere else in the world, and it is really incredibly helpful. What's even more helpful is that that data is published. So there's a website, anyone can just log on it, and they can see how good the outcomes are for their local service. So that's giving people who suffer from mental health problems a real voice. And they can talk to their commissioners about, well, my service doesn't seem to be doing quite as well as another one. Why is that? Why aren't you commissioning it more vigorously? So that's been one of the great outcomes of the IAPT program.
You have, I think, struck the rocks slightly now that money for this particular program is no longer ring-fenced. What's happening at the moment?
Yes, that's right. After a couple of years, we lost that ring-fence money. The government felt that the service should be paid for from existing resources, and then, of course, it's competing with everything else.
The program has obviously made a great difference, but it would, of course, be better not to need it in the first place. What do you think society should be doing to try and improve the mental health or well-being, or whatever the word is, of its citizens, so that we don't have to invest all this money in mental health care?
Well, I think the first thing to do is look after our next generation. We have the extraordinary situation that we teach our children a lot of things at school, but nothing about emotions and emotion regulation. And it doesn't prepare them for all the stresses that they're going to experience later in life. So we do feel that there needs to be a place in the national curriculum for teaching children about the emotions they're likely to experience in different situations, how their behaviour when they're emotional affects other people, and reduce the stigma associated with mental health problems, because the stigma is a serious difficulty. Because often, if you can get in early, the treatment that's required when someone's distressed is very modest. But if, because of the stigma associated with the problem, they don't seek treatment for 10, 15 years, which is true of a lot of mental health problems, things have got much more ingrained. So I think that's the first thing. The second thing is, some of us feel that there are some aspects of modern society with its very intense competitiveness and things, and being perhaps more centered on yourself rather than the groups that you're in and society as a whole, is not so good for our long-term mental health. So I think working out ways in which people can achieve the goals they want to achieve and realize their full potential without this intense sort of stress and competitiveness and comparison on the way would also help us, of course.